I'm Dr. Melissa Black of Empower Family Medicine. This is the first in a video series of information on different topics in healthcare. This video series is designed for patients who have health conditions or people who are caregivers for other family members or maybe professional caregivers who are paid private duty aides taking care of someone to help them understand some basic concepts in healthcare. We're going to be talking about things like reading a prescription and understanding prescription instructions, things you should know about different classes of medications, and some basic information about the healthcare system itself, emergency room care, hospital care. In later video series, I hope to cover preventive health topics, including topics in nutrition and functional medicine, but I find it best to start with the basics. So let's get started first with talking about prescriptions. I see a lot of people who are over-medicated, taking a lot of medications that they don't necessarily need to. Maybe they were started a long time ago and never stopped. So it's very important for you, if you are taking medications or caring for someone who is, for you to understand some basic things about prescriptions, starting with how to read a prescription. This information is also helpful for my first-year medical students who are learning to write prescriptions for the first time. We'll start with an example of a prescription. Here we see at the top of the prescription is a header with the clinic name and the doctor's name, relevant license numbers, the address, telephone, and fax, so if the pharmacist needs to reach the physician, they can. In the middle of the prescription, next we see patient identifiers. There should always be at least 2 patient identifiers on the prescription. Usually there's a box for name and address. There should always be the patient's date of birth and today's date, the date the prescription was written. Below that, we'll see on the prescription important instructions and the name of the medication. So first off, when prescription writing, we start with the medicine name. It's important to note that most medications have 2 names, a brand name from the manufacturer and a generic name, which is the chemical name that that medication goes by. In this example, we see the drug metformin, in parentheses is glucophage, so we have the brand and generic names. One common medication error I see is that people are given a prescription by one physician and that prescription is written for brand. Often, unless the doctor signs brand only, the pharmacy will dispense the generic or the lower cost of the medications per the insurance plan. Later on, the person might be given another prescription with the generic name on it, so they may get home and months go by and they find they have 2 different pill bottles, one with the brand name, one with the generic. Not everyone realizes that those are the same medications, that each medicine has 2 different names. And often I'll see people in my clinic who are taking 2 different prescriptions that are actually the same drug. So they're actually getting twice as much as they were supposed to get. So it's helpful for you to know the name of your medication and also the brand and generic forms so you can recognize that on your prescriptions or your pill bottles. After the name of the medication is the dose, usually in milligrams. If it's something that's a liquid, it might be milligrams per milliliters. And most drugs come in several different doses. So here we see metformin or glucophage, 500 milligram. Tablets, that's the form of the drug, so medications might come in tablets or capsules. They may come in a topical cream or a suppository. There are different forms of medications. So for people learning to write prescriptions, you need to make sure you have the name, the strength, and the form of the medication. Next, we see the instructions. Sometimes you'll see the Latin abbreviation SIG or SIG. That's the line containing the instructions for the medication. So here we see take 1 tablet twice a day by mouth. So in the SIG or the instructions for a prescription, we want to say the number of tablets or capsules or forms that you wish to be taken. So that's 1. The frequency, here it's twice a day. The route should be included. So here it's by mouth, but some prescriptions might be taken by suppository, rectal or vaginal suppository. Some people take medications by a feeding tube, so per tube might be in the instruction line. So in order to write a complete prescription, we want to have the number, the frequency, and the route. And ideally, the prescription should also include the indication, because some medications are taken for more than one condition. So if you don't write the indication, sometimes people may be hospitalized or under the care of a new doctor who is looking at pill bottles, and if the person doesn't remember what their pills are for, that care provider might assume what the medication is for and might put an incorrect diagnosis in the chart just based on misinterpreting what those medications are written for. So I try to remember to always put the indication for why I'm prescribing a medication on the prescription. Usually next we'll see DISP, abbreviation for dispense, meaning the number of tablets. And so that's where you would indicate, for example, if the drug is taken twice a day and you want the person to have a 30-day supply, you would write dispense number 60. If you wanted them to have a 90-day supply, you would write dispense 60 times 3, right, for a 3-month supply, or you'd dispense 180. And lastly, the number of refills. So those are the elements that should be included in any prescription. Continuing on with things you should know about your prescriptions. So on this slide is a list of abbreviations commonly used in prescription writing that it's helpful for you either as a patient or as a prescription writer to recognize and understand. So first, there are some abbreviations used in the dosing of medications. We see mg for milligrams, mLs for milliliters. cc is an older term which is equivalent to a milliliter, so 1 cc is 1 milliliter. We see drops, abbreviated as GTT. APP application might be what you would use for a cream. So if you want someone to apply some steroid cream to a rash, you might write 1 app topically to affected area twice a day, app or application. Next are some abbreviations for the route by which the medication should be taken. PO, these are Latin, something like per orum or by mouth. Next we see PR, per rectum, for example, if you were giving a suppository for constipation. PV is per vagina. SL is sublingual. Some medications come in tablets. For example, nitroglycerin for chest pain is given under the tongue, so that's sublingual. And then subcutaneous. Some people inject medications at home, for example, insulin given SC or subcutaneously. Also noted here are abbreviations for the timing or frequency of the medication being given. So the first one we see is QD, which is every day, QDay. Next is BID, twice a day. TID, 3 times a day. QID, 4 times a day. Now, if some medications can be given approximately. So if I say to give a medication 3 times a day, the person might take that in the morning, and then maybe at lunch, and then maybe at dinner, or if they forget, they'll take it at bedtime. And for a lot of medications, that's adequate. Other medications need to be taken at very specific intervals. For example, antibiotics or Parkinson's disease medications really should be given at as close to possible as fixed interval, at fixed intervals as close as possible. So for this, we abbreviate with the number of hours. You can see this example of Q8 hours. So instead of writing for a medication TID, which just means 3 times a day, I might write to take the medication Q8 hours, which means that the person should time it from the next dose, take it 8 hours later. You might say Q12 hours or Q6 hours. Next is QAC, that means before every meal. QHS, before hour of sleep or at bedtime. QAM in the morning, and QPM in the evening. The other abbreviation that's important to know is the abbreviation PRN, and that abbreviation means as needed. So if I tell someone to use their inhaler, PRN, then they're just going to use it as needed. I might write albuterol inhaler, use Q 6 hours PRN for cough. So that means use it every 6 hours if needed.